My child is snoring. Is that a problem? Our patients often ask this question. Persistent snoring, mouth breathing, and stuffy nose could indicate a condition called as an obstructive sleep apnea, and in children, most often it is because of the enlarged adenotonsils or inflamed adenotonsils. These enlarged adenotonsils with an OSA can lead into various other symptoms too, such as the child could be dull in the daytime, child could be irritable in the daytime, can have a recurrent ear infections, can have a dental crowding, and also there could be some facioskeletal abnormalities or changes in the structure of the face also. Allergy, especially the indoor allergen sensitization, is found to be very closely be related with adenoid inflammation too. So how do we assess about this? There are various tests which are available, such as a nasal endoscopy, X-ray of the nasopharynx, and sometimes even the allergy test, and to see if there is a fluid in the middle ear by a test called as a tympanometry may be required in such kind of a children. So if your child is having any of such kind of a symptoms which we already described, visit your doctor and take a step for the appropriate management.